Good afternoon. Today we will discuss about electrocardiogram. Electrocardiogram is studying of electrical activity of a heart. Normally, the electrical activity of all the cardiac muscle fibers that are recorded from the surface of a body is called as electrocardiogram. The machine or an instrument that is used for recording the electrical activities of heart is called as electrocardiograph. Whom needed this recording of electrical activity of heart is mainly the people with there is a deviation of their heart rate, or that is, it may be a lowest or highest heart rate. In some people there is a changes in their normal rhythm, that is heart rhythm, that is called as an arrhythmia, and they also needed some people having an abnormal electrical conduction, and in some cases there is a lag of heart muscle blood flow, that is poor blood flow to the heart muscle, and coronary artery diseases and hypertrophy of heart chambers. These are some of the cases they are in need of ECG recording, and ECG recording is done in the format of placing the leads in the Einthoven triangle format. This Einthoven triangle is nothing but this is helpful for identification of if there is any incorrect placement of leads in our chest. Normally it is an standard limb lead placement modality proposed by the Einthoven. Normally the heart is presumed in lie in the center of Einthoven triangle. So when the electrical potential is generated from the heart appears simultaneously on the roots of these three limbs, namely the left arm, right arm and the left leg. So the correct placement of these leads lead to the correct diagnosis. If there is any misleading of this lead placement will lead to the misdiagnosis. So this leads measures the electrical field created by the heart during the depolarization and repolarization events of heart muscles. The ECG is recorded using a 12 lead system. Normally the lead system is divided into bipolar and unipolar leads. The total 12 leads in unipolar and bipolar format they are arranged. In bipolar format they are divided into lead 1, lead 2 and lead 3. In unipolar they are divided into augmented limb leads or unipolar limb leads, and unipolar chest leads and precordial leads. In this unipolar leads, the leads are having only active electrode, that is positive. Another one is act as a indifferent electrode, that is acting as a negative electrode. This is the placement of bipolar leads, that is lead 1 and lead 2 and lead 3. The lead 1 is arranged in a right arm and left arm, then lead 2 is arranged between right arm and left leg, and lead 3 is arranged between left arm and left leg. In the unipolar leads, the unipolar limb leads and unipolar chest leads are arranged in a way, that is unipolar limb leads arranged as AVR, AVL and AVF, that is they are also called as augmented limb leads, that is only the one limb will be active at a time. The another electrode will act as a null point, that is active electrode is one of the limb only. The indifferent electrode is obtained by connecting the other two limbs through the resistors. In unipolar chest leads, they are also called as precordial leads. They are placed on sternum that is traveling in a posterior direction as shown in the below this image, that is V1, V2, V3, V4 and V5 and V6. How the conduction is happened in ECG, we will see. Normally the ECG waveform is depicted as PQRST waveform. This is the end product of a conducting system over our myocardial muscle, that is from atria to the ventricle. That is natural pacemaker is our SA node. It is a starting point or a conduction system. From SA node the conduction start, that is depolarization will happen. Then the impulse arrive to the AV node. From the AV node the impulse passes to the bundle branches, that is bundle of His. Then finally it reaches the Purkinje fibers. When the Purkinje fibers starts its conduction, it will reaches the ventricles. Then the depolarization of ventricular myocardium will happen, that is QRS complex. Then after depolarization ended, then T wave will happen, that is repolarization of ventricular myocardium. This takes the one heart cycle. The conduction start from AV, that is SA node, AV, then bundle of His, then to the Purkinje fibers, then it is passed through the ventricles. This is the one cardiac cycle, that is atrial diastole, that is the depolarization of atria, then depolarization of ventricle will happen. At the time the atria will starts pumping out, that is it start conduction. The resultant peak QRS will happen. That after the ventricular diastole, the ventricular systole will happen, that is S wave will started from there. This is an one cardiac cycle. Then these are the normal ECG waveform duration and amplitude chart. The normal ECG waveform has P wave, QRS, T wave, PR interval, QT interval and ST segment. And these are the causes and durations and amplitude values. And this is the graphical representation of the lead recordings obtained from ECG recorder. The first three, lead 1, lead 2, lead 3, that is a bipolar leads. Then another 9 are called as unipolar leads. First AVR, AVL, AVFS. In unipolar they are called as augmented limb leads. From V1 to V6 they are called as unipolar chest leads. These are the graphical waveform obtained from ECG recording. Then sometimes the ECG waveform having some arrhythmia, that is the people have some deviations, prolongations and elevations and absence of the waveforms. It may be due to the P wave or T wave or interval elongation, like that. So these are some of the arrhythmia conditions I here added. Mainly the atrial fibrillation, that is P wave won't be present in case of atria muscles are fibrillated. The another conditions, then the T wave conditions, myocardial ischemia, that is lack of blood flow to the cardiac muscles will causes the T wave to be tall and broad and asymmetric in shape. In sometimes the interval prolongation will happen, that is bradycardia or tachycardial conditions. And these are the some of the arrhythmial conditions happen when the people having a heart rate deviations or improper rhythmic conditions. So they need a proper diagnosis with the cardiologist. And these are the intro about our ECG recording.